Good evening, ladies. How's everyone doing tonight? Welcome to Wellness Wednesday, and I think we're good to go. Hope you've all had a great day. Now, we have a very important topic to discuss tonight. I am going to say my disclaimer as we wait for anybody else to join us that wants to. So, first of all, anything that I say tonight during this Wellness Wednesday is health information and not health advice. Please do not start or stop taking or change the way you're taking any of your medications. If you feel like you really need to, please consult first with your primary prescribing practitioner so that they can help you make the appropriate adjustments. And attending this Wellness Wednesday does not establish a doctor-patient relationship. Now, this topic is it's like all over the internet. When you're looking at health related topics, this is everywhere. All right. Detox, quite the buzzword, right? Quite the health topic buzzword out there. And you wouldn't believe all of the misinformation that's out there about detox. So, we definitely need to understand some things. And I'm frequently asked questions like, should I do such and such a cleanse? I was asked the other day about ionic foot baths. And of course, then there's sauna therapy, which I believe can be very good. In short, there are just a lot, so many detox tools out there. But the body was made to do this on its own. All right. Our liver is one of the most amazing organs. It's the most amazing detox tool on the planet. All right. Second comes the immune system. But there are a couple of caveats, though. Right. So, what happens when the liver, the body's primary filter, is not functioning fully to do the 500 different things that it does for our bodies? Right. What happens when you have the genetics that cause your immune system to not be able to get certain toxins out, right? What if you didn't already know, we're exposed to toxins every day, hundreds, thousands even. Cosmetics, our food is also laden with toxins and toxicants. Well, those would include things like pesticides and chemical stabilizers and preservatives and natural, artificial colors, artificial sweeteners, heavy metals, and so many others. Our water, unless it's adequately filtered or distilled, can be loaded with fluoride and heavy metals and lead and copper, things like that. Chlorine, chloramine, PFAS, arsenic, nitrates, pesticides, pharmaceuticals. I mean, so many things. PFAS, PFAS, are a large group of synthetic chemicals used in various industrial and consumer products, including things like firefighter foams and non-stick cookware, even food packaging, right? Stain resistant fibers, fabrics, things like that. The use of plastics introduces microplastics into the environment and into the body. They're finding the human body is widely contaminated with these microplastics. They've been found in organs and including the blood, your lungs, liver, kidneys, of course, brain, even. These have also been found in semen, breast milk, placentas, and bone marrow, places like this. The impact on human health of these microplastics is largely unknown, but they have been linked at least to strokes and heart attacks. Then, of course, pollutants in our air, right? Of course, smoking, illicit drugs, excess alcohol, and other toxins our bodies have to deal with, right? Well, I'm pretty sure the last time I talked about detox, Wellness Wednesday, probably last year sometime. I explained the liver has three phases of detox. Okay. And in a nutshell, these phases help to neutralize free radicals and toxins, convert these complexes to water soluble or less harmful complexes. And then these can be excreted or eliminated through the kidneys and intestines via urine and bile. All right. So understand that if you don't have enough nutrients for each of these phases, inflammation occurs, increases, and causes more symptoms and health problems. All right, so liver damage, infections, toxins, nutrient deficiencies, uh, certain toxicants and always, heavy metals can all impair the activity and ability of the liver to detox our bodies. Now, the kidneys function as the secondary filter. And, these at certain times when the liver is dysfunctional may be forced to excrete toxin complexes that don't get converted very well. When this occurs, this leads to kidney damage and chronic kidney disease. Of course, this ultimately leads to dialysis because there is no medical treatment for kidney disease. All right, I'm going to share my screen and just look at this with you guys. Let me see if I can get this little thingamajig to work. I can just get the edge of it. There we go. Okay, so you've got this drainage funnel. Hopefully you can see that big enough where you see at the bottom here is the colon, all right? And then above that, liver and bile ducts, and above that, the lymphatic system. Above that, organs, tissues, and then the top level of the funnel is your cells, or the deepest parts of your body, right? The deepest are your cells, and then down, these drain if they're allowed. If this funnel is draining properly, open, then your cells will drain toxins into your organs and tissues, and there's kind of a space between the cells, and then that'll drain into the lymphatic system. And then the lymphatics will drain into the blood that returns to the liver and bile system, so the liver. And then the bile through the detoxification pathways will then escort toxins into the intestines and out of the body. Well, as you can see here over to the side, you've got, and it's very faint, you've got skin, you've got kidneys and lungs over here. So if your liver is not functioning like it needs to, right, then then it's going to back up, if you will, these toxins, and they're going to have to get out another way through your lungs. So then you can get problems like asthma. You could even have problems like COPD that isn't necessarily linked to smoking or cigarette smoke. So kidneys, we were just talking about chronic kidney disease. And then skin, all right? How many of you have heard that when you have rashes, you almost always have a gut issue, all right? So your gut and liver isn't working properly to get these toxins out, and so they're going to come out, try to get out of the body through the skin. And this will indeed cause inflammation and things like eczema, hives, right, through the histamine pathways, things like psoriasis. Okay. So when you understand that this drainage funnel is absolutely crucial before you detox, meaning before you push things through, like out, and there are ways to do that, you've got to have your drainage pathways open. Okay. So cleanses and detoxes that can speed up the detox process can speed up if you lack nutrients, right? If which can cause these pathways to be less functional, right? When you lack um, nutrition, like like fatty acids, if you lack the right fatty acids, you're not going to make enough bile. If you lack certain vitamins, you're not going to help with this detox complex, this toxin complex formation, so that the bile can help those complexes get out of the liver into the colon. It's a real complicated process, but um, if you have if you give these organs and tissues enough nutrients and facilitate, maybe there are structural problems as well. So like gallstones and liver stones, or maybe you have um, certain viruses that are affecting your lymphatics. Then you're going to be backed up, right? You're not going to get the toxins out of your cells and your organs, right? So hope that makes good sense. Um, I'm just going to check my text really fast. Okay. So this is, one second. Okay, there we go. Um, this is so important for getting this right. Let's just say that it's got to be done right. Okay. So if not done right, and these pathways are less functional and efficient, then this poses serious health risks, including developing chronic degenerative conditions. Not the least would be autoimmunity, Parkinson's, and like cancers, right? So these liver cleanses, they can do more harm than good. If the filter is dirty, how can you, I'm going to stop sharing. How can you like push more through it? How do you do this in your house, right? How do you do this with your cars? They have filters, and you kind of treat this the same way. You put new filters in. Well, you can't put new filters necessarily. I mean, yes, you can put a new liver in, but that's a real process, isn't it? When you do a cleanse, you do eliminate some toxins for a week or two, but if you're not doing anything else, and you don't have the right nutrients, you don't have these pathways open, then you're just forcing toxins through, and this is what leads to further and further problems, more and more symptoms. The symptoms you had maybe just had come back, oftentimes worse. And so these toxin complexes build up, causing inflammation and disease, right? Now, bile is really important for detox. If you cannot make enough bile or bile salts to carry away these toxin complexes from the liver into the gut, you will get toxin backup, which can cause liver damage. All right, because you need bile for fat digestion, also not having enough can cause nausea, dizziness, fatigue, and certainly weight gain. This is why gallbladder dysfunction causes these symptoms, right? When it's broken, right, and cannot secrete bile in time to help digest the meal, you're gonna have issues. All right, it's important that detox be done in the right way. Without enough, nutrients, it won't work. With enough nutrients, if it's not pushed too hard, then we're going to have better outcomes. All right, we can better ensure that your liver is going to be able to handle this better. Hypothyroidism can lead to the liver not being able to detox properly, all right? Because the liver needs thyroid in every cell, right? Your body needs thyroid in every cell. Your liver needs thyroid to turn up its cell function, to turn up the cellular metabolism in your liver to help it, right? When it's not getting enough thyroid, it's not going to be able to do its job as efficiently. Menopause can lead to poor bile production simply because you have a lower level of hormones which are needed as well to help the liver. You ladies, you need estradiol. Okay, you need enough estradiol to help your organs function. All right. You often hear you need estradiol to help your heart and your brain and your bones, right? But you also need estradiol to help your liver function. Okay. And then the liver can detox you better. Now, the gut is also where orally ingested toxins are absorbed. So there's some natural barriers to this toxin absorption mechanism. And you will have heard maybe of the blood-brain barrier. Well, our kidneys and liver do have a similar mechanism for protection from taking in too many toxins. So this barrier system ensures movement of unwanted toxic compounds out of the cell and into those detoxification organs. Think about what might happen if too many toxins are present in the gut, right? These then cause a lot of inflammation. One in particular, it's called, these are endotoxins. One of those called LPS can interfere with this protective mechanism. They stop detox and promote more and more inflammation. And then, of course, this leads to many different symptoms. Signs and symptoms of poor detoxification are many and often include difficulty digesting fats because of gallbladder dysfunction or poor bile production issues, right? Poor absorption of nutrients. Now, you get this when you have celiac, especially. Celiac is a severe gluten intolerance and sensitivity, causing flattening of the cilia cells in your intestinal lining. They kind of look like little hairs that stick up. Increasing your absorptive surface, right? Well, when that all, when it becomes distorted and flattens instead, you don't have the absorptive surface, okay, for nutrients. Let's see, what else can you have? You can get bad breath, acne, premenstrual cramping is often due to poor detox function, hypoglycemia, certainly environmental allergies and asthma, hair loss. Yeah, many different causes for that, right? You all thought it was just low thyroid. Skin rashes, we talked about that a bit earlier. Certainly difficulty losing weight. Okay. Ladies, the key to success with this detox process is understanding what phases exactly need to be supported, what detox phases, especially in the liver and the gut, need to be best supported. This is best understood with comprehensive testing. Then we can put it together and see what nutrients are needed, see what you're deficient in, right? What diet changes would be best to make as well. We'd see what lifestyle interventions and changes are necessary. Especially when you don't have your gallbladder or when you do have bioproduction issues. Most importantly, what are the underlying causes for having the detox issues in the first place, right? And you have symptoms because of underlying imbalances. Your body is inflamed and you are lacking necessary nutrients. So with that, I'm super excited about this upcoming masterclass. I'll share with you why you aren't losing weight even though you exercise. Through this class, I'm going to share so much information, and that's just one thing. I'm going to share why you lose weight and then gain it all back plus more, and how you stop the cycle. And guess what? It has to do with detox dysfunction. I'm going to share with you how biotoxin illness and your home is likely the missing link to getting your life back truly. I want to share how to avoid the trap of believing that it's all in your head, related to your age, or just accepting this as your new normal. Don't fall into this trap. We'll look at all the current fad diets and what makes the most sense for your situation. The fallacies, the false narratives, the lies that are perpetuated by the diet and weight loss industry. Among many other things, I'm going to share with you step-by-step weight loss blueprint that has worked for thousands of women just like you. So masterclass is going to be, it starts on the 21st, 22nd, 23rd. So Monday through Wednesday at 7 p.m. Mountain Time. So 6 Pacific, 7 Mountain, 8 Central Time, 9 Eastern Time, right? Now, I also do a Q&A as part of the masterclass, and I, will answer a lot of your questions then. I will take a couple of questions now, if you have some. So let's see what you might have for me. See if we have any questions. So this question, can this cause UTI issues? So when you don't detox properly through your liver and your bowel, then yes, you can have things come through your kidneys, right? But they're not. This isn't necessarily going to be, unless you have major internal bacterial issues, which you would probably notice way before having a UTI. It's not necessarily a typical detox reaction to have a UTI. Not to say that it wouldn't happen possibly, but it's not a typical, UTIs are not typically caused by detox issues. The next question is, drinking Metamucil good to take in when working at getting detoxed? And you may be thinking, well, if you increase your bowel movement by taking Metamucil, which is essentially psyllium fiber with a bunch of other additives, which I don't recommend. I definitely don't recommend Metamucil in particular, but maybe increasing fiber for some of you, that might work, that might help. It can help, but I won't say for sure, simply because you don't know if you've got problems with that, with those detox, with that barrier function, right? You don't know if you have problems with that, and whether you are, just absorbing toxins anyway through your intestines, and then you might have more bowel movements, but it doesn't mean you're necessarily going to get more toxins out. So that may or may not help. So she says, my gallbladder was removed. Will this be an issue my whole life? Short answer, yes, it will. Longer answer is, when you're missing your gallbladder, and I've done, you might want to go back and watch the Wellness Wednesday that I did on gallbladder. When you lack your gallbladder, you are not releasing bile at the right time when you eat, right? When you eat is when you're supposed to release that bile, and that's what the gallbladder does. The liver instead is just releasing any bile that it's producing whenever it wants, okay? It's like no rhyme or reason to it. Often at night, when your liver is most active, is when you're going to release more. And then you might have issues with random sporadic bowel movements, sometimes even like you're dumping something real fast and it comes on, it can cause explosive diarrhea and bowel movements. With this actually can affect you your whole life. And it means that you will need to take certain enzymes to help with digesting your food, because again, you're not releasing, the gallbladder isn't there to release this bile in time, okay, at the right time. So, oh wow, a lot more questions, good. What's a natural detox? I am thinking apple cider vinegar with cayenne pepper and ginger. Like I said, these cleanses are good, but they do have their downsides. When you lack certain nutrients, and you won't know unless you get comprehensive testing done, if you lack these nutrients, doing a natural detox isn't necessarily going to be helpful. Like I said, maybe a week or two, and then you can make things worse, okay? Or the symptoms all come back and they're back worse. Explain how genes won't let us remove toxins, like my comprehensive though you showed. Okay, sounds like someone I've met with. So when you have these genes, they're specific HLA-DR gene, DRDQ genes. These encode for problems within the immune system that cause, so there's a handoff that happens in your immune system. Certain immune system cells grab onto the antigen or the toxin and are able to then hand it off to another immune cell, which then will be able to escort it out of the body. When you have these certain genes, they're called biotoxin susceptibility genes, then you won't make the handoff. It fumbles the ball. Okay, for those of you football fans. So then you can't get these toxins out, and they stay and they get reabsorbed into your tissues and cause disease, cause autoimmunity, cause liver toxicity, cause reproductive organ toxicity, they cause cancer. So if I didn't say that already, it's important that we know that you have these genes. That way we know what to do to help you, because we do know how to help you. Okay. What do you do when some of the detox supplements make you feel not so great? Will it take longer if you have to take different or less supplements? And yes, unfortunately, it will. So sometimes you have to decrease your doses, right? Your coaches who are working with you generally have you do that. They have you decrease the doses, or they may suggest not taking all of them, maybe taking just not taking a couple of them, taking those out of the mix, if you will. So it just depends on what they think is the best approach. So your clinical team will work with you on that. Skin rashes during deep detox is common, or is it a concern? It's not necessarily common, but it happens. I mean, it's common enough, I guess, but it doesn't always happen. And it's not as much of a concern. If you realize that it's happening because you're detoxing, again, try to back off on your supplements. Stop pushing so much, right? Take probably need to take a different look at strengthening the liver a little more. So maybe adding some other types of supplements would be helpful, right? To strengthen the liver's ability to detox you, right? Yeah, this is good. She's saying, I'm on the program now, first few days starting detox protocol and just 2 months new to the program. I've not released any weight yet. Will weight be released? Typically, once toxins are removed, yes, that is how it works for many, or for some, I should say, some. Hoping weight release, will happen sooner than later. So yeah, of course. One of my wonderful patients, Janelle, she was frustrated like this as well. First of all, keep in mind, a couple months in is not long. That's not a long time. It took years to get you this way. It's depending on your toxic load, it may just require several to many months. And it did for her. It took at least 6 months for her. And I know that sounds like such a long time. You're like, oh, Dr. Redd, don't say that. Look, you're in this for the long haul now. You've made a wonderful decision to get these things taken care of, not just so you could lose weight, but so you can get healthy and get these toxins out so they don't cause disease if they're hadn't already. And I'm talking like insulin resistance and diabetes and Hashimoto's and other autoimmune diseases. And you want to put those types of autoimmune diseases into remission, and you want to get your body healthy and get rid of this insulin resistance, and then the weight will release. And this is what happened with Janelle. She finally started releasing the weight, and she was so happy, and it did. It released. She was able to release like 30 pounds or so in 2.5 months at that point. I mean, it just started to fall off. So And then that obviously helped her feel much better about herself. And she felt healthier anyway. Her energy was better. So many things had improved. Her sleep had improved already. Her hair had improved even, right? Hair loss had really slowed. But it was just that stubborn weight that didn't release until the toxins came out. And I showed this in the masterclass. I showed you a progression of tests showing toxins coming out more and more and then less when they were petering off, right? Tapering off. So that's that's a real important thing to recognize, ladies, is that this is not a quick fix. This is not a for some of you. This will take a longer period of time, several months. And then the next question is, what happens after you complete your detox program? Is there maintenance? Yes, there is something I call aftercare, and and I usually tell you that's possible when I speak with you first and accept you as a patient. But your coach will talk to you more about that and what would be the frequency maybe for your aftercare, what testing might be needed periodically. Definitely not as often as you're getting it during your program, because that's designed to check your progress frequently and to help you, sooner rather than letting you go 3 to 6 months while, which happens with your regular doctor. And you're like, well, that is such a long time and I didn't even get anything to do. So what do I do? Or you're told to just go lose the weight, or maybe you are told something. Maybe you were told to eat less and exercise more. Anyway, that model doesn't work. So, after you go through this amazing process, then you just might need some periodic follow-up. So yes. Will you discuss more in Mounjaro, Ozempic, and what are people to do now that they are on, or that should they be on them? Please go back and watch the Wellness Wednesday, entitled "The Not So Miraculous Weight Loss Drugs." Please go watch that. These will ultimately, because you have to stay on them forever, right? That's what they tell you, and with good reason, because once you do stop them, you'll gain the weight back, just like any other diet out there. It's just like any other fad diet out there. Okay, you have to stay on them forever, and they're damn expensive, and insurance doesn't typically cover them. I mean, this is not the answer, ladies. A drug isn't ever the answer. Okay. They do interfere because they cause insulin to rise. And we're going to teach you all about that. We're going to teach you all about that during the class. Body odor. I never experienced any type of body odor, but have noticed I have it now that I'm detoxing. Is that a good thing? Yes. I mean, it's not good smelling, but it is a good thing. It means you are releasing these toxins. Now, you might need to talk with your coach and healthcare team about increasing your, your care team here, about increasing your binders. Okay, so that can be helpful. Okay. Oh, so once you know the nutrients you're lacking and get this addressed, your body will then self-detox. Yeah, we have to give you the nutrients and then your body does it, right? Your liver does it. Your liver and your intestines, that funnel I showed you, it's opening and it's draining. And then you're, having going through a more efficient detox, if at all possible. Okay. Perfect. No, great questions, ladies. Gets you thinking, right? Gets you thinking about things. Because as you attend these, as you stay active in this group, you're going to find answers, right? So have hope, right? And remember, you do have the power to heal. I tell you that so often, and it's true. So thank you for joining me tonight for Wellness Wednesday. All right. Have a great night, everyone. We'll see you soon.